Hello, it's Dr. Rhonda Johnson. Today is Thursday, March 21st, 2024, and tonight I'm talking about vascular dementia. Well, vascular dementia most commonly occurs after a stroke or a brain hemorrhage or blocked vessels in the brain from atherosclerosis. Now, when this happens, the brain gets deprived of the oxygen and other nutrients that it needs to function. Now, vascular dementia can also occur after many strokes, and vascular and Alzheimer's dementia can occur at the same time. Now, just know that every stroke does not cause vascular dementia. Whether a stroke affects your thinking and reasoning depends on your stroke's severity and location. So what are the symptoms of vascular dementia? Well, they can vary depending on the part of the brain where the blood flow is impaired, but signs and symptoms can include confusion, trouble paying attention and concentrating, reduced ability to organize thoughts, slowed thinking, difficulty with organization, difficulty deciding what to do next, problems with memory, restlessness, agitation, unsteady gait, a sudden or frequent urge to urinate or inability to control urination, depression, and apathy, just to name a few. So what are risk factors for vascular dementia? Well, basically anything that increases your risk of heart disease and stroke increases your risk of vascular dementia. That includes diabetes, the familiar list, high blood pressure, high cholesterol, smoking. Increasing age, your risk of vascular dementia rises as you grow older. It's rare before the age of 65. And if you live to be in your 90s, the risk will rise substantially. Elevated levels of that bad cholesterol, LDL cholesterol, can increase your risk of vascular dementia. So if your doctor talks to you about going on therapy to lower your bad cholesterol, such as statins, you may want to think about that. Obesity, being overweight, is a well-known risk for vascular diseases in general, and therefore increases your risk of vascular dementia. Atrial fibrillation is another big risk factor because atrial fibrillation increases your risk of stroke. It can cause blood clots to form in the heart that can break off and go to the brain blood vessels, and there you have it. So how do you prevent vascular dementia? Well, again, the health of your brain's blood vessels is closely linked to the health of your overall blood vessels and your heart health. So taking steps to keep your heart healthy may also help reduce your risk of vascular dementia. Now, all this week I've been talking about dementia because it's important. The numbers are increasing throughout the United States and throughout the world. So as people live longer, we want to live healthier with the full use of our brains. That's my message today. As always, take care, folks, and be well.